I'm here to explain the different types of enemas and colostomy care. I'm only going to focus on 3 types of enemas. There are a few other different kind that you can actually do. First is a cleansing enema. It's a water-based enema and it's a hypotonic solution. The temperature on it, you have to have it slightly above body temp at about 98 degrees Fahrenheit, somewhere in between 98 and 105, but you don't want it too warm, because if you have it too warm or too hot, it'll be too much for your patient. And it doesn't take that long to actually do the enema. You just have to hold it in for a few minutes before evacuations occurs. The next will be a Harris flush enema. It's used to evacuate the flatulence. It's mostly used on patients that has gone to surgery and they can't remove the gas. And all you need is about 250 mLs of water and warm tap water for that. And you will take and insert the tube and then put the water in, and then wait for it to, the water or the flatulence or the gas it's pushed out along with the water once the water comes out. The next would be a Fleet's enema, and it's used, and it's usually at room temp. These are the enemas that you can actually find over the counter. You don't have to use the whole tube. It's just kind of like what the doctor ordered. All you need is about it's about 118 mLs in each one, and all you need to use is what you need, and mostly it's a hypertonic solution in it. When you get ready to do the enemas, you would need to actually do an assessment on your patient. You would actually go in, clean your hands, identify yourself and identify your patient with two means of identification. You would need to do an abdomen. You would have to check the patient's bowel sounds and make sure that there's anything. And so you would also want to find out from them when their last bowel movement was or anything like that. And then you would have to have with you clean gloves, lubricant that's kind of warm, because you don't want to insert an enema that's dry. You would have to have waterproof pads that are absorbent. You would need like a bedpan, a bedpan or a bedside commode, toilet paper. You would need things like that to be able to clean up your patient once the enema has gone forth and the patient actually evacuated their bowels. And then once the enema is complete and you've cleaned up your patient, what you're going to want to document is how well the patient tolerated the enema, what kind of bowel movement they had, whether it was large or small, whether the stool was soft or watery. You want to assess if the patient have hemorrhoids or anything like that. So you would document those kind of things. And then as far as colostomy care you go, you would actually, when it's time, you don't have to change them every day. They only have to be changed every now and then. And then as far as the colostomy care goes, you would have to have scissors with you. So you can be able to cut the colostomy to the patient's size. You don't want it too big and you don't want it too small. It has to be able to fit just right. So you usually use a measuring tool to actually measure before you actually cut. And when cleaning the colostomy, you also want to make sure you have, like I said, the right size pouch. You want skin barrier. I usually use some kind of like soap and water or to be able to clean the area once I've taken the colostomy pouch off. And then when you get ready to pull the colostomy pouch off, you don't want to just yank it off. You want to be able to ease it off so you're not damaging the skin. And then when you go to apply, you apply it. And you want to make sure it's secure, that there's no openings on there. And then you take the clamp and you close it off. And that's pretty much colostomy care as far as being able to change out what you're doing for colostomy care.